Personalisation is about choice, flexibility and control. It's about people knowing what their needs are and people having control over how those needs are being met.
Personalisation to me means that everyone has a person-centred plan for their support and their care, or their employment, or their housing, the whole spectrum, and that they're at the centre of that, and where it's appropriate that carers are fully involved in that. And it also means that for some people with very complex disabilities, for example in learning disability, that they've had access to a really good multidisciplinary assessment and really good advice. It also means to me that people have choice and they have control. That doesn't mean an unfettered choice and total control, because none of us have that, but it does mean that they are able to choose from a range of options what to do with their lives, what aspirations they have, and how all the agencies working together can support them to achieve those dreams and those aspirations.
It's certainly going to change thinking and change the roles and responsibilities quite a lot, and of course it already is doing in some of those authorities that are, you know, ahead of the game, shall we say, or at the forefront of this change. One of the things is I think it may focus on the different functions, the different responsibilities that need to take place, not all of which will eventually end up, I suspect, in the traditional social work role, but just things like, you know, the activity around deciding how to give, or the best way in which to give people advice and information, and an understanding of what people need to think about and know about in relation to their care and support needs. Then, if you like, the process of actually allocating resource to people if they need an ongoing set of help. You know, then all the work, if you like, around looking at the market, understanding cost and understanding how you buy these things, and then of course safeguarding, reviewing. So all those different functions are there at the moment, supposedly within one role, but I think they do need to be unravelled a bit, and we do need to think about who's best to do them. Do we need a bit more specialism? You know, who should be the employer of those things? And I think that's all up for debate, a bit like it was actually in the mid-1990s when community care started to unravel and the new responsibilities for carrying money, if you like, in social services departments.
What I think it's going to do with frontline social workers is make them reflect on their practice. I think that certainly as I grew up in the social work profession, I was still wanting to do things to people and for people, and what personalisation is going to be is about helping people articulate what they think is best for them. It won't stop the social work task, which is to help people get to that stage, and I think it puts a premium on actual social work skills, because instead of saying to people, maybe quickly say what you really need is Meals on Wheels, what you really need is a day service, what you really need. And I'm not saying that people do that glibly, but I think when you're helping people to make such important decisions about their own life, which they're going to control more, the social work task becomes more important.
Actually, the social work task becomes both important in trying to help people look at their lives, understand what's happening for them, look at where recovery might be a possibility. For example, this morning I was talking to somebody from the Guide Dogs Association for blind people, and he was saying not enough time is being spent with people who are newly acquired visual impairments to actually help them deal with their feelings, deal with the issues, and help them come to terms with being blind, acquiring the blindness, and then helping them to get their recovery. So that's a really important task for social workers, is working in that field. When actually we've made a decision that someone does need long-term care and support, again, working with someone, probably taking more time over an assessment than we used to take in the past, in the kind of early community care days. So actually trying to get to grips with the holistic person, that we're all about someone's life, to help work with them and shape the kind of services that they might need, they might benefit, that might give them better outcomes. So actually there's a really important social work task.
I think the impact is going to be different in different circumstances. As I've said, there are many people with very complex needs, and needs that can vary hugely from time to time, and they will still need really good social work skills around assessment, around social workers working with other professionals to make links with mental health, with primary care trust, district nurses, specialist nurses, psychologists, psychiatrists, so that people have a really rounded assessment that they're the centre of, and all those skills are going to be needed. But there will be some changes, because people will expect to be much more central. They will expect their voices to be heard through advocacy or through carers saying what their views are and what they're able to do and not do. So it's going to be an environment where every one of us is going to have to be more open to working together with somebody, almost co-producing a kind of support and care package. And where people want to control that all themselves through a direct payment or their individual budget, then we must enable people to do that. So I think there's going to be still lots of really interesting and challenging things for social workers, but it's going to evolve as we always have evolved in social work.
Not at all, because one of the things about social work is if you're doing it the easy way, you're doing it the wrong way, because if it takes you longer to help somebody to dress themselves than to do it for them, and it takes you longer to work with people on their agenda than to impose yours on them. So I think it will take more people to do the kind of job that we would want to do for everybody in this country, and that we should be able to do.
Well, being an optimist, I actually think it's going to mean we will need more frontline social workers doing the kind of things they were originally trained to do. Maybe I'm a bit old-fashioned in that view, but it certainly seems to me the kind of skills I learned 30 years ago are the very skills that people are going to need now to make personalisation work.
The early evidence is that actually there's more time needed in that assessment process in order to really get to grips, to really understand. And instead of doing kind of like series of assessments, doing one good assessment and then having reviews to make sure that that assessment, that the services the person's purchasing or is arranging for themselves actually are meeting their goals, then actually there's a really important social work task. So I wonder whether we're actually going to need more social workers.
A very simplistic view would be that we can pass this work on to people of a lower level and we can do with fewer social workers. It's actually quite a complex agenda. It goes to the very heart of working with people and trying to get them the kind of personalised services that they want. And I think you need very, very skilled people to do that.
I don't see that happening. I think that the assessment task becomes more important. I think making sure that people have informed choice people have to be helped to do that, not jump for the first thing that they might think is a good idea. And social workers' skills are about helping people to make the right decisions for themselves, and I can't see any way in which we would need fewer staff to do that. I think it will put a premium on the training, and I think we need to be talking to the colleges about what the skills will be needed for people working in this way.
Well, I would initially say there's no obvious evidence that that would be the case. We have clear responsibilities to the whole community for safeguarding at the moment, and I think when people do raise that question with me, my immediate response is we must think about and pay attention already to what seems to be around half of all the money that's spent privately by individuals in purchasing all sorts of care and support, apart from the other half that's spent, if you like, by councils in the public sector. We already know that there are lots and lots of people out there buying and spending money on all sorts of care and support. We already have safeguarding responsibilities for that group, which I don't think we're necessarily perhaps taking seriously enough, and of course once you join council funding to that, the same issues that are already there will need to be applied. So we must look at this as a whole community approach. We need to think about the balance of risk and personal responsibility versus protection and safeguarding. That balance has to be right. It needs a mature debate. You know, adults are not the same as children. We have to make a judgment about whether it's proper or not, if you like, to go above or around the decision of an adult individual about their choice around risk. And that's a very complex process, which of course with children it's complex as well, but children are children. This is a different agenda, and I think it needs a lot of thought.
Again, that worries me. I mean, I would like to know what the right direction should be. I have seen so long the need for people to have dignity about controlling their lives. If you talk to users, they want to have as much control as possible over their own lives. They don't want to be done unto.
Actually, it's about what social workers should be about. People say, if I needed services, I would want the very services that improve my quality of life. But if I didn't know exactly how to go about getting them, I'd need some expert like a social worker to help me do that. I think the problem has been with some of the changes, many social workers see the issue as perhaps something that's about saving money, about downgrading their status. Personalisation isn't about these things.
We have over 2,000 service users and their carers in Oldham who now have individualised budgets. Those service users and carers are very happy with the change in how they receive a service. So I would say that what we need to do is think through how staff who are unsure of what personalisation is, we need to do much more about getting them in touch with the outcomes that it delivers for service users, because it does change the outcomes for service users. Service users are in control, service users have choice, service users have much more flexibility over their lives, so it is about helping more staff understand that message.
I've got mixed feelings about the personalisation agenda, because really it's little more than all of us should be able to expect from services, that we would be treated with respect and treated in a dignified manner, and that we would be able to choose what services we want and how we should be treated and contribute to the service package, rather than being confronted with something where we have no choice and it's a done deal and so on. So I guess I think that should be an integral part of social work provision anyway, and it surprises me that some of my colleagues are expressing concern about that agenda. But of course, perhaps that's why the government feel that transformation is the watchword, and that people need to be helped to see the light and move towards the sorts of services that everybody deserves to expect at times of need.
It is the direction of travel. I think we've got to be a little careful about saying it's the answer to everybody's needs, because there will still be a lot of people who will say, I want you to do that, I want the state to provide that. And we've got to listen to that. The idea that everybody should be on a personal budget, an individual budget, by a certain date, I worry about that. Everybody having the opportunity by a certain date, that's a different kettle of fish. And the direction of empowering people, ensuring that people make their own decisions, what we would want for ourselves, instead of being done to, what I would like, the power to control, and social care and health services, informed choice, not overwhelmed by choice, but options available. And there will be a further social work task, which is to develop those options, working together across local authorities and with the independent sector, giving people wider range of choice, what would be right for them.